have straight hair, hit puberty, have curly hair, got pregnant, went back to straight hair.
All right, everyone, we're gonna go ahead and get started really quickly, and this is not, okay, that'll turn on in a second. Thank you to those of you who are here. Just a couple updates before we get started. So volunteering, thank you to everyone who's participated in that so far. There will be lots of events coming up throughout the year, so don't worry if you haven't gotten any hours yet. Ronald McDonald is not going to happen next weekend, or next week, so just heads up on that, but that'll show up on the Google Doc too. And then remember to make sure you're signing up on the Google Doc for attending events and then emailing the hours that you spend to Katie. And like I just said, more opportunities will come up as the year goes on. And if you have any suggestions or questions, just please reach out. For those of you who ordered apparel and clipboards, I just got an email today that everyone paid for clipboards. So they will be sent out by the end of this week. And then I will have all of the apparel and clipboards next week. And I'll email you guys times to pick that up. And then just a reminder about attendance. If you're watching meetings online, please remember to upload your attendance form within 1 week of the meeting. And that's it. If you have any questions, please email me. Please welcome Megan.
I know, really. Thank you, thank you.
If you want. I don't know how to make it view in. So it's like the full thing.
Well, we just swear I just did this. Just like show here if you want. And then just from the beginning. Yeah, I think that'll work.
Okay.
Awesome. Well, thanks for having me, you guys. All of the second years know that I can talk a lot, and I will talk to you guys forever. So, and they gave me like no boundaries here. So, I just want to kind of talk to you guys a little bit about hand therapy and kind of the specialty and how to get there. But this can be very informal. So if you guys have any questions or want me to elaborate on anything in particular, feel free to stop me. We can talk about whatever you guys would like to. So first of all, just to kind of introduce myself, and I won't spend a ton of time talking about myself necessarily, but I graduated from Colorado State University with my degree in occupational therapy. I did my second field work at the time. Well, I didn't do my doctorate, so we didn't have to do the DEC. But my last field work I did, I was lucky enough to get hired on, and my last field work was in hand therapy. So I went straight from school into hand therapy. So I have practiced in hand therapy my entire OT career. And the more people I talk to, the more I realize that that's not particularly common, which creates a little bit of a challenge to get into hand therapy or to become a CHT. And we'll talk about that here in a little bit. But I started at a large outpatient facility where I treated for about 6 years, and then I opened up a private practice where I currently am now. And primarily I practice out of our clinic in Wheat Ridge. So really briefly too, just to kind of tell you guys, because people ask me and my patients ask me, you know, why did you get into hand therapy? And I think a couple of reasons. I really like the anatomy, I really like the biomechanics. But I also had a couple family members who had really bad hand injuries. My grandma was in a rollover when she was about 18 and rolled a car onto her hand. It was very severe injury. She was hospitalized for years, had gangrene, had fractures, had nerve damage. And for some reason, you know, here I am, this child, completely fascinated. And I would show my friends. I thought it was the coolest thing ever. So very fascinating to me. And then my dad had a partial fusion, had pins, and it was just so fascinating. And so when I found that you could specialize in hand therapy as an occupational therapist, I really felt that that was what I wanted to do. So I'm going to touch on this a little bit throughout this talk. As far as hand therapy, there's a fine line between OT and PT. And if you're interested in hand therapy, you will have to be a little bit prepared to defend yourself and kind of say why you're there and why you're better than a PT, because we do have very similar backgrounds. So I'm going to just touch on kind of the history of OT, and I'm sure you guys have probably had classes and talked about this, because I really feel like hand therapy was a really integral part of the beginning of OT. And so it's kind of interesting to see that and see how it's continued through all these years. So really occupational therapy started, I'm sure as you guys know, World War I and as well in World War II, when the soldiers were coming back and they were injured and they were essentially what they would diagnose them as with shell shock, which we kind of would probably classify as PTSD at this point. But these soldiers were coming back and they were essentially bedridden, injured, and mentally they were really struggling. So the U.S. War Department brought in what they called reconstruction aids at the time, and essentially they were brought in to reconstruct these soldiers into, back into a more normal human being. So OTs were originally, there wasn't, they didn't say bring in all these occupational therapists. So they brought in teachers, artists, social workers, nurses. They brought all these people in to help these soldiers to kind of get better. And as you guys will learn, and as you've probably already learned, there's a lot of that in our background and a lot of that still in what we do today. So then in 1952 is when there was the polio outbreak, and that's where OTs kind of got into the pediatric world. And then there was also 1963, the Community Mental Health Act, and that's kind of where the psych part became really a big part of OT. And then also, in 1975 and 1990, that's where a lot of the education and then OTs kind of infiltrated the schools at that point. So OT is really unique in that you have a lot of options when you go out there. You can do school, you can do hospital, you can do inpatient, outpatient. So really you have a lot of opportunities. Do you guys, what areas are you guys interested in? Peds. Yeah. And there's a lot of pediatric hand therapy too. So those two can kind of go hand in hand. It really kind of depends. If you're in a more orthopedic pediatric setting, you will do a lot of hand therapy. If you're in a school setting, so it just kind of depends. But your options are really endless, which is kind of nice. So if I had a quarter for every time somebody came in and said, "Oh, so you're my PT," it's really rare. Sometimes people will come in and say, "My doctor told me I just have to see a PT for my hand," and I said, "No, I don't. I have to see an OT," and I'm like, "Oh, you know." So it is pretty rare, and in a lot of settings, not just hand therapy, you will be called a PT. So you may need to, and it really honestly depends on the situation. Sometimes I correct people and sometimes I don't, because it's just, you choose your battles. If you have a patient who walks back and they're on the phone, "Sorry, my PT came to get me," I'm like, whatever. But if it's a doctor, if it's somebody who's a little bit more educated in healthcare, I will typically tell them, I'm actually an occupational therapist and this is the difference. So just be prepared to explain what you are. So definition of hand therapy. So hand therapy is the art and science of rehabilitation of the upper limb, which includes the hand, wrist, elbow, and shoulder girdle. It is the merging of occupational and physical therapy theory and practice that combines comprehensive knowledge of the structure of the upper limb with function and activity. Using specialized skills in assessment, planning, and treatment, hand therapists provide therapeutic interventions to prevent dysfunction, restore function, and/or reverse the progression of pathology of the upper limb in order to enhance an individual's ability to execute tasks and to participate fully in life situations. It's kind of a mouthful. So this is actually at my clinic, and we have a PT and an OT kind of playing a little tug of war with the patient. But, I've been really lucky that I've worked with, I don't know that I've ever worked with a PT who's been difficult, but a lot of OTs find a struggle working in an outpatient, especially orthopedic clinic where the PTs may look down on you, whatnot. And I've never had that situation, but you may run into that because you do kind of cross that boundary a little bit. So theoretical framework, it's really biomechanic based. We do a lot of objective measurements, a lot of range of motion, strength measurements, etc. And your insurance companies will want that. So as much as my school was very anti-hand therapy. They just didn't feel that it was functional. But again, if you look at where OT started and why it started, your hands are so functional, and without them, you really struggle. And I've had many patients come in and say, you know what, I had my knee replaced, and it was easier for me to do my everyday activities than having my non-dominant carpal tunnel released. Your hands are so functional that without them, it's really hard to get by, you know, with your day-to-day activities. But it is very biomechanical, a majority of it. So what do we treat? You know, we treat a lot of things, a lot of things. So this just really kind of just touches on some of the more common diagnoses that you'll see walk into a hand therapy clinic. A lot of nerve compression, so carpal tunnel syndrome. Do you guys remember what that is? What nerve? Median, yep. Cubital tunnel syndrome. Do you guys remember what cubital tunnel syndrome nerve? Ulnar nerve, yep. Lateral and medial epicondylitis. Lots of fractures, so somebody will fall and break their wrist or their elbow or their shoulder or their finger. Lots of sprains and strains, lots of cumulative trauma. So you'll see a lot of people who come in and they're just like, my arm's just hurt and I wake up with pain and I sit at a computer all day, and things just, you know, accumulate and you end up with pain, tendonitis, nerve compressions, etc. Lots of post-op, so you'll see a lot directly from hand surgeons. So nerve and tendon injuries. So if somebody lacerates a flexor tendon, they'll go in and fix it and they'll send them to you right away after that. Nerve releases, lots of carpal tunnel releases, lots of cubital tunnel releases. ORIF, so that stands for open reduction internal fixation. So again, somebody will fall and break their wrists, they'll go in and put a plate and some screws in there and then send them to therapy. So some of the treatments that we use in hand therapy, and I realized, don't tell Dr. B, but I forgot to put modalities on here. We do use a lot of modalities. So we use a lot of ultrasound, e-stim, hot packs, cold packs, paraffin. We also do a lot of soft tissue work. So you'll work on mobilizing the muscles, the tendons, joint mobilization, active, passive, assisted range of motion exercises, either with you or at home. A lot of ergonomics. Like I said, we see a lot of people with just cumulative trauma. And, you know, one thing that you want to not do as a hand therapist is just focus on the hands. You do need to treat the person as a whole. If somebody comes in with carpal tunnel, a lot of it can be addressed by looking at what they're doing every day and how they're doing it. So how are you sitting at your computer? How are you at the gym? You know, people will not do their gym exercises, they're lifting correctly, and so that can lead to a lot of problems. Splinting, which is probably by far my favorite part of hand therapy, that's one area that we really differentiate ourselves from PTs. PTs can be CHTs as well, and I've worked with a lot of PT CHTs that'll call me and say, I have an extensor tendon repair, they need a dynamic splint, I'm going to send them to you, because PTs, their education does not have that piece of it. What they have is really minimal compared to what you guys will have when you walk out. Progressive resistive exercises, depending on the diagnosis, what you're treating, you'll walk people through an exercise program, you'll give them a lot of stuff to do at home. A lot of people want to get back to the gym. That's really important to a lot of people, which is great. But if you have an injury, you need to, the therapist is really an important part in saying, you can do X, Y, and Z. This is how you progress that as you feel better. FCEs, that stands for functional capacity evaluations. That's a treatment or a test, actually. It's usually about 4 hours where the patient will have something going on. The doctor will want to see where are they as far as can they go back to work? Can they go back to doing whatever normal activities they want to do? And you'll run through a whole gamut of testing of strength and endurance, sensory, etc.
How do you bill that if it's 4 hours?
You bill out a specific code for that, and you bill out like 16 units. And depending on the insurance, a lot of work comp insurances pay for it, no problem, but a commercial insurance probably won't. So like at my clinic, if I ever have somebody who's in a lawsuit, for example, because you're going to see that a lot with people that are in a lawsuit, or that they think they can't go back to work, but their doctor thinks they can, we will get prepayment because otherwise you won't get paid. So you're going to spend 4 hours of your time, and then it's a big report that you have to do. So then you've got an hour or two of documentation after that. And if you get paid for, $60 for one treatment, that's not going to cover your cost. So, And depending on the area that you're looking at, so I have an OT that does all of our SCEs, but if it's like a low back pain or something that she doesn't treat very often, then we'll have a PT come in. So now I've got my 4 hours of my OT time plus an hour of my PT time. So you really do need to bill strategically to get paid for that. And then I put in mental health. So as much as hand therapy is very biomechanic, people don't heal well if they are not healthy mentally. And you'll have somebody with the simple, like I said, like a carpal tunnel release, something super simple. And 4 months into treatment, their complaints are still, I have a 9 out of 10 pain, I can't do anything. And I tell you what, once you're in the field for a while, you'll learn like how people progress and how they get through, certain after surgeries, et cetera. And everybody is different, don't get me wrong. But when you have somebody who's just presenting not normal, you can pretty much rest assured that they have something going on at home. Something is not right with them because they're just not, I really feel like if people are not psychologically healthy, they're not physically healthy either. And so you'll have to pull out some of your psych background in hand therapy as well. And people, as a hand therapist, you're kind of like a hairdresser. You're sitting right across the table. It's a very intimate setting. You're holding somebody's hand for half hour at least, and they will tell you everything. And they often need to. I mean, that's a big part, like I said, it's a big part of healing, but it can interfere with their physical healing. So you'll have to pull out some of that psych background and be a little bit of a counselor often. So I just put in a few splints. I just took some pictures of some splints that we've made over the past few weeks. So the left, on the one on the left side is just an ulnar gutter. We actually left it, rather than wrapping it around, we left it free volarly because the doctor wanted her to do some range of motion. So she had a proximal phalanx fracture. So we're trying to get her down into that intrinsic plus position that you guys have done. I didn't get her quite down far enough, so she actually has come back periodically because obviously she's a week out of a fracture, so she's in a lot of pain. So we're trying to get her down where she needs to be to get that fracture reduced. On the right side is a hand-based thumb spica splint. This lady had some CMC arthritis, some early CMC arthritis, and wanted to ride her bike and couldn't because it was painful. So we actually made her bilateral thumb spica splints that she can wear when she rides. This one, the one on the left, those are silver ring splints. This lady is a librarian, and she has trouble typing because her PIP joints lock in hyperextension. So these silver ring splints hold her in just a little bit of flexion that allows her to type during the day. And then the one on the right is the delta cast, which you guys have made. And that wasn't my patient. I'm actually not sure what exactly that diagnosis was. I'm guessing from the position it's probably an extensor tendon injury. So definitely, we get to do a lot of arts and crafts in our day. So it's a lot of fun. So how do you become a CHT? So there is, HTCC is the Hand Therapy Certification Commission. They have a website, www.htcc.org. There's a lot of information there. So you can definitely hop on that, and there's a lot of resources there as well. But HTCC was established in 1991 to recognize occupational and physical therapists with advanced clinical knowledge, experience, and skills in the practice of hand and upper extremity rehabilitation. And to date, there are over 6,228 certified hand therapists worldwide. So in order to become a CHT, you need to have this, and this is where it gets a little bit hard for a new grad, because it is, again, I've come to find out that I was pretty lucky to be able to get into hand therapy right off the bat. Most of my fellow hand therapists, as I've talked to them over the years, did not. A lot of them practiced in a hospital setting or a different setting for a while, for several years before they actually got into hand therapy. But you need to have 3 years of practice experience with 4,000 hours or more in direct practice in hand therapy. So if you work a full-time job, that's like 2,080 hours a year. So over 3 years, I would guesstimate about 60% or so of your time needs to be directly in hand therapy if you want to take it at that 3-year mark. But I was actually just at we hosted a joint mobilization course at my clinic, and I heard some hand therapists talking, and one of the girls was like, you know what, I'm not ready. I'm 3 years out, I can take the test, and I'm just not ready. And that's fine. When I got out of school, it was 5 years. So I practiced for 5 years before I sat for the exam, and it still is not easy. So I don't think you need to use that as a hard and fast rule that it has to be 3 years out, even if you do have that experience. I think you can definitely take it whenever you feel ready. But then you also have to do the successful completion of a comprehensive test of advanced clinical skills and theory in the upper quarter rehabilitation. They do offer the test now two times a year, and it's the first week in May and the first week in November, Monday through Saturday. So you can sign up for that whenever you do feel ready. So I know at this point in time, you guys are probably thinking, how could I possibly take another test? And you guys have to get through your regular OT boards first, you know, but at this point in time, you'll probably be over that trauma. But there are a lot of resources as far as studying. HTCC has a lot of stuff, and they're getting better and better every year. They have blogs that you can get on. They have, so you can kind of do online study groups. They have some continuing education through their website. And they also have some study guides on their website, which are really helpful. You also, they're big, I think we might have brought one in for you guys during the summer. There are big, like encyclopedia style books on hand therapy, and there are 2 volumes. They're huge, and they contain pretty much anything you ever want to know. And when I was studying, I did go through those quite a bit. But I have to say, this book that I took a picture of here, this book, it's kind of almost like a question-answer style. So it'll ask you a question, you'll have your options, and it'll have the answers. I essentially went through this book and just memorized the whole thing. And I feel like 90+% of the test material was in this book. So when you guys get to that point, and it's not huge, it's, you know, just about an inch thick or so. When you guys get to that point, I would highly recommend this book. And then also just getting into any local groups, the Denver Hand Special Interest Group was actually started by a group of therapists that were studying for their CHT. And it's been probably since the early mid-90s that they've had this group. And at this point, we do some journal clubs and some physician lectures. Really inexpensive. It's about $30 a year as far as the dues go. So definitely worth it if you guys are interested. It also gets you out into the community. Then there's some other groups like Rocky Mountain Hand Surgery Society. They bring in hand surgeons. They'll fly them in and talk about much more technical things. But it's still a great way to kind of network and learn some more advanced hand therapy stuff. So last, where do CHTs practice? You know, you can kind of, there are a lot of different options, but I would say the most common places would be a hospital setting, inpatient or outpatient, a private outpatient clinic, or physician-owned practices, which are much more common nowadays. Do you have any questions? You're looking very sleepy.
It's hot in this room.
It is very, I thought it was just me. It is very warm.
Was your private practice already established when you worked there, or were you part of creating it?
Yeah. So we started, I worked at the outpatient, the corporate outpatient clinic. And then I had a hand surgeon ask me to come and work in his office. But the way hand surgeons are, they practice in clinic for part of the time and they're in surgery part of the time. So he's like, well, I just need you when I'm in clinic. So I was part-time there, part-time at the big corporation where I started. And I just at one point thought, you know what, I'm bringing all of his business there. Why not bring it to myself? So another girl that I worked with, her and I started a clinic literally in an office. So we had like a 10 by 10 foot room where we practiced. And we've expanded since then. But yeah, we started that from the ground up.
Okay.
Yeah. So, and I'm happy to know a lot of students, at least second years, are interested in doing private practice, which is awesome. It is a big undertaking, but it's awesome. And so if you guys have any questions or want any guidance on that, I'd be happy.
How many years did that take to get it going?
You know, we had at the time, we had a business consultant that was working for the doctor's office as well. And so we had her just kind of help us. I mean, literally just like passing in the hallway, giving us a few suggestions about stuff. And so because we had kind of, and this is where it's tricky unless you have a pretty solid referral source to start. We had that, and so we started, and she was like, I've never seen a business be successful in the first 3 months, and you guys are. So it was pretty easy for us. And I've known people, like there's a hand therapist here who came from Australia and said, I'm opening up a private practice, and she just did it. And it's a lot more groundwork because she didn't know anybody. I mean, she wasn't even from the United States. So it's a lot more groundwork for sure. But I definitely think if you guys get to a situation where you have a consistent referral or you have good relationships with people, I think that's really when to start your private practice. Otherwise, it's not that you can't do it, it'll just be a little harder.
Do you have a favorite like patient story or anything from your past that was either like crazy or went really well?
I should have thought about this. I'm sure I have lots of stories. I have to think about that.
Okay. Yeah, no worries.
She's like, thanks for
I know.
I'm sure you were gonna ask that.
I know, seriously, because like in an hour, we'll be like, okay, I got a great story for you guys.
in the middle of
You can tell
that.
I know, you guys will miss out, sorry.
I feel like 6,000 in some is not that many worldwide. Are you in very high demand?
So somewhat. I mean, it's hard to find a CHT. It's not a huge amount. Like when I read that, I thought the same thing. You know, that's not that many when you think about it. And it's a very small network. I mean, I could tell you, I bet I could name almost every hand therapist in Denver, and we all kind of know each other. And that's why just getting into some of these groups would be good for anybody who's looking to get into hand therapy, because there aren't that many. So, and I've had a couple of other therapists who had students who now have come to these groups, and now we have one working for us PRN. So, because again, she's trying to get that experience.
Because it is such a small group of people like in Denver area, do you find that each one of you has like a specialty that sets you apart from the others, or how?
Not really.
Okay.
Not really. You know, I think everybody has different, and you know, the treatments that I gave you guys, those are like your basic, that's what you'll have in your toolbox when you go to start. But you'll learn all kinds of stuff. I mean, I've done lots of continuing ed and myofascial release. So if we have somebody who, you know, I'll have another therapist call me and say, hey, this person needs myofascial, like stuff beyond my scope. We'll kind of trade off patients as needed. We had a hand therapist that for years made leather splints before we had the Delta cast material. And so she was the only one in town, and we all went to her. We had a therapist that was like, she kind of managed the only amputee clinic in Denver, and she's since retired essentially. But so to some extent, you'll kind of have your specialty, but for the most part, we all are kind of the same. So.
How many therapists are at your practice?
The whole thing? I think we have 15. No, that might not be right. Probably about 12.
And they're all hands?
So we have 5 hand therapists, and then 3, 4, 5, 6, 7 PTs, and 1 speech therapist.
And how exactly, so if you're not technically a certified hand therapist, how do you get the hours then?
That's what that's the thing, it's hard. So you have to find you either have to find a clinic that will take a non-CHT.
Okay.
And
you can still practice like that?
Oh yeah,
Okay.
Absolutely.
Everything?
Yes, you can still do absolutely everything. And I have a friend who actually was a CHT, and then she let it lapse, which don't ever do that if you guys do. But, and so she is actually managing a clinic. She manages the whole hand therapy department, and they have 3 or 4 clinics as well, and she's OT. She doesn't have her CHT.
So you have to find someone that's willing to
right.
have them on CHT.
And that's, like I said, that's the hard thing. And it's best if you know, I was kind of put into a clinic where I was working with a CHT during my internship, and then they needed her to go to a different clinic, and they handed me this clinic, and kind of, you know, sink or swim sort of thing, which was hard. So if you guys have the opportunity to work under a CHT, at least for a few years, that's best, because you'll learn a lot. And I learn a lot from all my therapists. I learn a lot from my PTs. I learn a lot from my speech therapists. So it's best if you can be in a situation where you have other therapists to work with. But yeah, if you're trying to do upper extremity, if you could find somewhere with a CHT that is willing to take on a non-CHT, that's the best option.
Do your level 2 or any kind of field work hours count towards that
I don't
practice?
think so. I don't think so. You might want to clarify that, but I don't think so.
So then what's the benefit of getting your stage T if you can do all the same things as an OT?
If you want to work in hand therapy, it's getting a job and getting physician referrals.
Like I don't think Dr. B's gonna pay.
Probably not. Yeah. Dr. Loman's not either.
Oh yeah.
Yeah. So, and they both worked in upper extremity. You don't have to be. And again, like I was telling you about this girl who was a CHT and is not now, but if people
They
know
also have
you,
experience.
yeah, if people know you and know that you have the experience, it's fine. But if I worked with a doctor for, well, he's still practicing, he still gets some of his referrals, but his referrals come over as they CHT only. So, and again, if you're looking for a job in hand therapy, from a marketing standpoint or referral standpoint, it's really best if you have that CHT. It just proves that you went that extra mile.
Where would you say for interventions, like what, is it Clinton where you spend the majority of your time? Or?
No, probably not. You guys have asked like how many splints I make a day or a week, and back in the day we worked with a surgeon who would refer us tons of splints, so we probably made 3 or 4 a day. At this point, we probably make 3 or so a week. Everybody's different, so it just kind of depends. I do a lot of manual treatment on my patients. I think part of it, like I said, you go back to that psych aspect. It's just putting your hands on somebody. They need that. People need that to heal. They need that to, especially if it's a work comp where they don't feel like they're being taken seriously and people aren't listening to them. And I'm telling you, like the most minor injury can become huge if people don't feel like they're getting the attention that they need. So I do a lot of manual stuff. I do a lot of myofascial. I do a lot of soft tissue. I do a lot of joint mobilization. Again, depends on the patient, but I would say I try to spend at least 20 to 25 minutes of my 30-minute treatment doing hands-on. Any other questions? At least you guys had questions today. That makes me happy. I'm in class with them. I'm like, any questions? And they just stare at me. I'm like, come on, ask me something.
I think it's the evening lab that
That
just
doesn't
kind
help.
of you're just like done for the day.
Yeah, that doesn't help for sure. Especially because you guys have been here all day.
Not today.
Not today.
Oh, not today? Why? Did you not have morning roll?
We were off campus. Well, some people have it today, some people have it other days.
Oh,
Doing like
that's okay. At a preschool?
yeah. So we do know.
That's interesting. Is it a public preschool? Like a...
One's a Montessori.
It was
Montessori.
the other one
Okay.
was connected to a church.
Yeah.
I don't know what.
Oh, interesting.
It's for people.
Okay. Well, that's very cool.
Thank you so much.
Yeah, thanks for having me, you guys. That was fast. I talked fast. I could talk for hours. That's the problem. I'm trying to make it not. Do you think this really makes any difference? Do you do that? Do you safely eject your stuff? Sometimes. So I'm like, does it really do anything? And how do you think? No, me either. I don't think it's going to get involved anyway.
Okay, 2 more slides real quick. Our next meeting is November 29th. We're gonna have food to be determined exactly what it is, but that'll be kind of just our celebration. So please come. And then we're not gonna have the meeting on December 6th because it was literally the week after the previous one. And I think everyone would just appreciate some time to study for finals instead. So next meeting, November 29th, there will be food. And for those of you watching online, we're a day late, but the password is trick or treat. Thank you.
So December 6th, that's canceled, right?
Yes.
Are we doing?
write you down a cheat sheet. It's hard to it is like having some information to know kind of where your parameters are. But
Most of just like already figured that.
that's what's so hard for me. I'm trying to think like I can ask on some of it, but with a lot I can't. And my high voltage unit is the security research. But that's the only thing I can switch.
I almost had how often do you do some for the meeting?
Yes.
With that.
I need to print out sometimes and I use it high volt, but I need to use. I know Dr. Big on 10, but I feel like it's just
What?
talking about how I feel about it.
Yeah,
Ours
ours
that too. It's like it's just hours.
Yeah, it's exactly.
back here.
And with the high volt, I feel like it's that
And then she was like,
I know there's a different one.
let's not go in that direction. And it was like, finding all new sources.
It's like a